Meet Janet. Janet is an active 62-year-old who just returned home after a total knee replacement. Her surgery went well, but now she's feeling a bit apprehensive about her recovery. Her knee is painful and stiff, and she's finding it difficult to move around. She wonders if her recovery is on track. A few days later, Janet arrives for her first physical therapy appointment with Steve. Janet explains to Steve that she isn't sure what to expect and is wondering if everything is going all right so far. Steve explains to Janet that everyone's recovery after surgery is a little different, but if she would like, he can generate a personalized prediction using the knee recovery app. Janet agrees and fills out a brief questionnaire. Steve measures her knee joint mobility and physical function. He enters all the information into the knee recovery app, which uses similar patients in the past to create prediction. Janet's measurements are plotted on a graph, which allows her to see how she is doing relative to her peers and visualize her predicted recovery over the next few months. Steve explains to Janet that her knee joint mobility is right on track for this point in her recovery, but her function is lagging a bit behind. Steve reassures Janet that her goals are achievable, and he proposes a physical therapy plan focused on strengthening to help her improve function. Janet appreciates her individualized plan and is motivated to work hard. She feels reassured in her recovery. A few weeks later, Steve reassesses Janet's progress with the knee recovery app. Janet is thrilled to see that her function has improved greatly. Steve points out that Janet's recovery is now ahead of schedule compared to her peers. Together, they decide to reduce Janet's frequency of therapy, reserve some of her visits for later, when Janet is ready to start participating in recreational activities again. Janet is feeling much more secure and optimistic in her recovery, and she's excited for what her future holds.